So a question that I often face is, Doctor, is IVF right for us or can we proceed with IUI? Before I talk about IUI or IVF, we have to know that every couple is different and the cause of infertility is different from every couple to couple. So it is not whether IUI is better or IVF is better. It is about what is the right treatment for your diagnosis. So before we suggest you any treatment, we first run a few tests on you and your husband so that we get to know what is the actual cause of infertility. Then if I talk about IUI or IVF, these two processes are completely different. While IUI is more natural, IVF is something which is happening inside the laboratory. So what do we do in IUI? In IUI, we start with your normal period cycle and track the time when your ovulation is happening. At the same time, we take your husband's sperms, we wash it, and we put it one step ahead, straight inside the uterus, so that your chances of conception increases. The chances of conception in IUI would increase because of two factors. First is we are timing the process. Whenever ovulation is taking place, we are putting the sperms inside. And number two, we are closing on the distance between the sperm and the egg. But what we have to remember is it is still a natural process where fertilization takes place naturally and implantation takes place naturally. When we get couples where there are mild male factor problems, sperm problems, or there are few ovulation disorders, or maybe unexplained infertility, we tend to proceed with IUI. On the other hand, what happens in IVF? In IVF, we have a much better control. The eggs are retrieved from your body. They are fertilized inside our laboratory under proper controlled environment with the sperm to form an embryo. This embryo is then further grown in our lab so that we can select the best embryo out of the lot and then put it back inside the uterus. So hence, as I told you, this process gives us better control over fertilization and embryo development and embryo selection. So is it better for everyone to go for IVF and not for IUI? Definitely not. Whether you need to go for IUI or you need to go for IVF would depend on your age, the number of eggs in your ovary, that is your ovarian reserve, the health of your sperms, the tubal health, and your past history. So we have to remember that while one treatment might be appropriate for a person, another treatment might work for the other person. We get successful pregnancies with both IUI and IVF. So what is important is to get the right diagnosis first and then discuss your fertility journey with your caregiver.